An important weekend coming up for ACR Health in Syracuse, which will be hosting its 33rd annual AIDS 5K Run Walk. Well, like so many nonprofits, ACR Health is facing serious federal funding cuts. Talk about both topics. ACR's Executive Director, Lisa Alford. Lisa, thanks for joining us. Really appreciate it.
Thank you so much for having me.
Let's start with those funding issues. How much is at risk for ACR Health right now?
We really are concerned about $4 million of our overall $10 million budget that potentially could be impacted by the changes at the federal level and the executive orders. So that's what we're most concerned about. We haven't lost any funding yet, but the landscape base is actually, shifting. We're watching the new federal rules very closely, impacting the services that we currently provide. And it's not just about funding. It's the ability that we would have to be able to serve people with the dignity that we've done provided for over 40 years. So we're certainly very concerned and very focused on that.
How difficult is it to run an agency like yours when you literally don't know? 4 million of 10 million is, I don't have to do the math, that's a lot of money that could come out of your budget. And even if it's only a part of that 4 million, that's a big impact.
That's correct. So certainly the impact would be very great, not only for the clients that we serve, which we're most concerned about, certainly the staff that we have and the impact on them and their families, and the impact that the larger community might have as a result of the loss of funding. Frequently, people may not know about or think about it impacting them. Maybe they say, well, I don't receive services from your organization, but you may employ people who potentially would be impacted. They may be part of neighbors in your neighborhood. They may be persons that attend your faith community and the impact that it could have on them. So the impact of these types of changes or the instability or concern about the instability, we know we are concerned about the well-being of our clients with this changing and sort of unknown environment that we're in, the impact on our staff and their well-being, on their ability to be able to plan and make decisions about how they're going to spend their resources. So it certainly has far-reaching impacts on our community.
Are you already starting to kind of put, I guess, maybe contingency plans in place, A, B, C, if this happens or if we lose this amount of money, kind of what we do and how we try to continue to provide what we're doing now?
Yes, we've looked at contingency plans. We've looked at the analysis of which programs or funding we feel might be at greatest risk. We've focused on preparing as much as we can some of those contingency plans, but as I said, so much of the information changes from sometimes from day to day. We've worked with our legal counsel, as well as making sure that the community is aware as much as possible of the opportunities we have like this to share with the community the impact and why their support is so important. We know that local support becomes even more important when those federal rules and changes shift. And we are not wanting to compromise, or we're not going to compromise on the type of care that we provide, but we know that it can change what we're doing based on that funding that we have.
Yeah, at least one of the smaller ways people can help out and get involved is the annual Run Walk. It's this weekend. Probably more than just a fundraiser, but also a real statement about the importance of your agency in our community, I would imagine, but also a fundraiser too.
Yes. So this Sunday, as you mentioned, we've got our annual AIDS Walk Run. We're starting out at the Sawmill Creek Shelter at Willow Bay, and check-in is at 9 o'clock in the morning, and the walk and run itself starts at 10 a.m. And as you mentioned, it certainly is more than a fundraiser. It's a statement that the community can make about how important they value and view the services that we provide and continue to provide with compassion and inclusion, and certainly at a time when there are policy changes that may be impacting that. Now is even greater an opportunity and time for the community to be able to come out and show their support by walking or running. They can come out and just cheer other people on. They can help volunteer, what have you.
Last quick one for you. How do people get involved? Do they have to sign up ahead of time? Could they just show up that morning?
They can certainly just show up that morning and sign up to walk or run, but we have information on our ACR Health, www.acrhealth.org website, where they can sign up in advance to register to walk as well as to volunteer.
Lisa Alford from ACR Health. Thank you so much, Lisa, for joining us. Let's talk again soon.
Thank you so much.